Los Bromos here on 99.5 WSOS on this TGIF Friday, 1 minute after 8 o'clock, a beautiful fall day. And Dr. Kalpana DePasquale joins me here live in the studio, and she is ready to go camping with her family this weekend. She's got her jeans on, her boots. No, actually she doesn't. But she will eventually, right?
I am ready. It'll be a lot of fun. Good quality time.
So I've never, I have to be honest, other than being a Cub Scout back in the day, it's been a while since I've been camping, maybe going back to college. So, do you cook at a campfire? I mean, are you going to, make beans and franks and things like that?
Yeah, well, we have all kinds of different stuff that we have, but it'll be a good time. It's a great quality time with the children and being outdoors, being in touch with nature. Always a good time.
Dr. DePasquale and her husband have two great teenage boys, and so they're going to have a good time. It'll be nice and cool when you get up on probably tomorrow. Are you going tonight or tomorrow?
Tonight.
Oh, so tomorrow morning when you get up, it'll be 61 degrees.
Yeah, great weather.
And then Sunday, actually Saturday night leading into Sunday, it's supposed to get windy. And we're supposed to have gusty winds of up to 25 miles an hour. So you have to work at keeping the tent up and all that.
Right.
Everybody will have to work together. That's a good thing.
That's right. It'll be very adventurous feeling.
So when you start the fire, the campfire, do you insist that it be done the historical way? I mean, that you do it the way the pioneer families did when they were trekking across Wyoming?
No. I'm happy if there's
cheat?
a fire.
So I have this image of you all doing it with just flint and stone and.
Well, I really don't do any of it. I kind of supervise. And I really don't even do well at that.
Oh, that's funny. Well, actually, I think it's great stuff. Dr. DePasquale, of course, with St. Augustine Ear, Nose, and Throat. She is the founder of that medical practice, and she's been a part of our community here in St. Johns County for a long time. Office is located, of course, over on the island, just off of the 312 bridge once you get on the island, and also a relatively newer location, which is on US 1 in Ponte Vedra in the northern part of the county near Nice High School in that part of the world, right?
Yes, the north part of St. Augustine.
Which is growing. There's a few people moving in there.
Oh, there's just a few. It's amazing what I've seen happen in that area just in the past 6 months.
I know. If you haven't seen the St. Augustine Record newspaper today, there's a big announcement of a big 3-story Class A office building that's going to be built over in Nocatee. So they're going to get started on that here in just the next few weeks or so. So that just indicates how much growth is going on in that part of the world.
Absolutely. I think it's going to be an exciting time up there.
Yeah. So we want to talk with Dr. DePasquale today about some things relating to, issues with costs and also, second opinions. I wanted to kind of deal with that a little bit. We always hear that, from a physician, or we see it on television. You're certainly welcome to go get a second opinion. Especially on a dramatic TV show, when somebody gets that horrible cancer diagnosis, go ahead and get a second opinion. But I will tell you, as a consumer, as a patient, we feel really awkward about that. We feel like, it's what I feel like if I have been seeing you for a few years, Dr. DePasquale, for various sinus issues or what have you, and then, somebody told me, well, you should go get a second opinion, I would almost feel like I'm cheating on you. I would. I feel bad. Do you understand what I'm saying?
Oh, yeah.
I want you to kind of explain to the patient and the consumer out there why that shouldn't be the case, because I think most of us do feel that way. We feel like, if I go see another ear, nose, and throat specialist, Dr. DePasquale may find out about it, and then she's going to think less of me.
I think there's a right way and a wrong way to do everything. So if a patient came to me and said that, I think it's also the way it's done. If they're very upfront about it, very nice about it, they'd like to just see maybe if another doctor has another opinion or another way to handle things. I really don't think most people would be offended. I think if you do it in a different way where maybe you're not quite as nice or as upfront, or maybe if we find out about it later when we get the records request or something like that, I think that feels worse to a physician. And that's just my speculation. That's how I would feel about it. But I think in any case, if you do it the right way, if you just are upfront with the doctor, tell them how you feel, and I think it can be a pleasant exchange in that way.
So my takeaway from what you're saying, Dr. DePasquale, is when we want to get a second opinion on a medical procedure, whether it's dealing with ear, nose, and throat or even something else, the best thing to do is just to be upfront with our doctor about it.
I think so.
I certainly respect you, Dr. DePasquale, and this is a big deal for me, which you would probably say, yeah, Kevin, it is a big deal. And And then I would, say, well, I'd like to get, I think I should get a second opinion on that. No, no offense meant or anything.
Right. I think that is totally fine. And that happens. And sometimes what I actually love the most is when that has happened to me, they've gone and gotten the second opinion. Sometimes, again, doctors can disagree. So most of the time, if it's something that they do agree with, they usually come right back to me to have the procedure done. So it's really not, I don't think it's meant to be offensive, but in the hearts of most people. I think they just want to make sure they're following the right track. If there's another way, if there's another idea that somebody else has, and I think everybody's entitled to that.
Right. So one thing you brought out that I didn't really realize, or I wasn't really thinking of, is the notion of the records themselves. Because I guess if we go get a second opinion, and there's been a variety of blood work done or there's been other tests done, we really don't want to go to another doctor and say, well, I think I have this problem, and, because I don't want you to ever find out about it, I don't tell them that I've already had all these tests, right? I mean,
exactly.
There needs to be an exchange of these test records and things like that. Otherwise, we're just incurring more expense and we're slowing the process down, right?
Oh, absolutely. It's just important, if you're going to go get a second opinion, make sure you take the records from the prior doctor, the blood work, any kind of diagnostic studies, CAT scans, MRIs that you've had done, and make sure they have all that stuff available for the doctor who's providing the second opinion so they really can look at it and not have to start from scratch. I think that makes it a lot easier.
And we'll get back here to the music here in just a second. It's about 6 minutes after 8. We're with Dr. Kalpana DePasquale, of course, with St. Augustine Ear, Nose, and Throat here in St. Johns County. What are our rights when we ask for records? That seems intimidating, too, because my primary care doc is Dr. Eric Schramm, who's right next to you at your office up in the north side of town. And, everything he has is electronic. So what, are they going to give me like a little zip drive or something? I mean, if I ask for my records, which also feels weird, I got to tell you, I know Dr. Pasquale is kind of looking at me like I'm a goofball, but I'm just telling you as a patient, it really does feel like I am doing something wrong. It makes me feel like I'm like making this bold, obnoxious statement. I want my records.
Well, again, I think if you want your records, you have every right to view your records and have them for your own knowledge.
So I can take them.
You can take them. They're yours. And they'll just we just give you a printout of your records if that's what we don't put it on a zip drive, although I think that's possible. I have no idea. But bottom line is, if you want your records so that you can keep track, because I have patients that really are very, very methodical about their tests and what they've had done, and they want the records. They want the notes because they keep it in nice little folders and files, and they bring them to each office visit. So that's very, very understandable and really preferable, so that you can give your doctor a really good history of what's already been done.
Right.
So nothing
because I would
wrong with
imagine
that.
As a physician and as a specialist like you are, Dr. DePasquale, you really don't want to go on sort of a treasure hunt, expedition, right? I mean, for you, it's better for me to give you all the information, not for you to have to go hunt and peck.
It makes a big difference, because it really, not that we can't do it, but once we have to start looking and fishing around for studies, and depending on the places that the studies were done, the time frame that we get the studies back could take 10 minutes, could take hours, could take days. So in many instances, we may just have to reschedule you because we don't have all the information. So that's terrible. If we have it all, we can really give a better assessment at the time of your visit, which is more convenient for everybody.
Very, very interesting. Well, once again, we're talking about second opinions. We're going to talk about misdiagnoses and all sorts of other things that impact your healthcare, regardless of whether it's ear, nose, and throat related or not. But of course, we are spending time with Dr. DePasquale, who is founder of St. Augustine Ear, Nose, and Throat. If you'd like to learn more, if you'd like to schedule a consultation, try to remember this website, saent.net. That's saent.net. We'll be right back with Dr. DePasquale.
I went to a garden party.
Sean Cassidy and the Do Run Run Run, the Do Ron Run Run Run. Now, that was a tough lyric for somebody just to come up with, Dr. DePasquale. You could write a song like that. You're a musician, right? You enjoy music.
I enjoy music, but I definitely would not call myself a musician.
Now, you've been, you're pretty accomplished, though, right? You play the piano?
I do play the piano.
Do you write music? Have you ever tried writing music?
No, not at all.
Is that something you might want to do down the road?
I don't think I even have a clue how to start. If it's presented in front of me, I can learn how to play it, but not to come up with it.
I heard an interview not too long ago with somebody, I think it was in their 30s, who was a composer, and that's basically what they did. And I find that to be amazing, that somebody could sit down and how do you even think of what music could sound like and then actually put it down in writing, like Beethoven and what those guys did?
Yeah, I have no idea. I mean, I am not good at that. It's funny, our neighbors across the street, they are musicians, so I would call them musicians. So Phil could just sit down in front of the piano and just play anything that he wants to play, but I can't do it without music and having practiced it, so it's a very different style. Yeah. Some people can just sit down and just play something, where if you ask me to play something, I can't play it. Yeah,
when you see jazz musicians in New Orleans or whatever, even here in town, they can just sit down in front of a piano and immediately make music on the fly.
Right. That is not me. I have to practice.
Yeah. But then again, you're involved in all these complicated procedures, dealing with our head and our nose and our throat and sinuses. And I have no idea, I mean, there's no way. I could barely use a Q-tip. I can't begin to understand what you do.
Well, when you use the Q-tip, don't stick it too far in your ear.
That is really good advice, isn't it? Not to go off our train of what we're supposed to be talking about today, but can't you, when people use Q-tips all the time, doesn't it just sort of pack the wax back into their ear?
Yes, and not to mention, sometimes I've seen people get the cotton in the Q-tip stuck in their ear, or they've perforated their eardrum or damaged their ear canal. So, yeah, not a good thing to do at all.
So why does our ear, not to get too far off track, why does the ear produce wax?
Well, the wax,
what's the purpose of that?
Wax actually serves a purpose. It lubricates the ear canal. It has antibacterial effects. So it is very necessary, but obviously in copious amounts where it blocks your ear canal, it's not necessary in that amount.
Okay. And it's not really wax, is it?
No, it's not really wax. It's all kinds of different things, antibacterials, and it's got a mucin. I don't even remember what all it has in it, but it's definitely a composition of many, many materials.
Is it possible to through medication to control how much wax is produced?
Well, we can soften it. There's some over-the-counter medications that are available to soften it. You can even use hydrogen peroxide and water to soften it. So there's a lot you can do to keep it under control.
Well, don't worry. This entire Friday morning is not about earwax. If you're sitting there listening and you're having breakfast right now, you're saying, Kevin, why'd you get off that track? It's just one of those interesting things about your body, that when you have an expert, you want to actually ask. Dr. DePasquale is with us, and of course, she's the founder of St. Augustine Ear, Nose, and Throat. She joins us on Friday mornings. By the way, you can always email me if you'd like at staugustineradio.com. Just hit the contact us button. If you have any questions for Dr. DePasquale, we'll pose those to her. We'll give her a little advance notice even, or we'll just present them right when she gets here, and she'll be happy to answer any questions that you might have. Today, we've been talking about a couple of issues dealing with second opinions and misdiagnoses and things like that. And before we went to the song break, we were talking about the importance of feeling comfortable in getting a second opinion. And you had some nice, succinct advice, right? If somebody is in a situation medically and they are a little tentative or they're scared, they have some anxiety, they want to get a second opinion, how should they approach the physician they're currently working with about getting a second opinion?
I think the best way to do this is to explain to them that the patient should say to the doctor, my God, I'm getting tongue twisted today, that they respect that physician, but they are concerned about these diagnoses and want to see what the other options are, and they would like to get a second opinion. And I think just being brief and succinct is the best way to go.
Okay. And of course, I guess the goal is not necessarily that you're looking for a health condition to be completely misdiagnosed, because, studies indicate that's pretty rare anyway, right?
Yes. I mean, often it's not really a misdiagnosis, but it's more that doctors often have different opinions about things. So, where one doctor may want to take, let's say, an aggressive route, maybe another doctor may be more conservative. But then some doctors actually can be too conservative. So maybe your style is going to be somebody who's kind of in the middle. So I think it's really important to find a doctor that fits your style of what you want to do. I mean, maybe that's not always possible, but the bottom line is I think it's best to know what available options that there are so you can make a decision based on knowledge and facts.
I guess not just in the ear, nose, and throat arena, but across anything that may deal with our physical bodies. There may be different ways to address the same problem, right?
Oh, there are. There really are. And again, in ENT, I know that there are. So again, even with a cancer diagnosis, maybe one doctor wants to use one set of drugs and another wants to use a different option. There are just so many different ways to do things in medicine in general. It really doesn't hurt to see how different the opinions could be and find an opinion that suits the way you want to go about your health care.
I could see a situation where, say somebody went to you on an ear, nose, and throat matter or a sinus issue or something, and then they sought out a second opinion, and maybe there were just little nuggets that they learned in that second opinion. Then they would come back to you and say, well, what about this? What about this? What about that? And then you end up sort of coming up with a hybrid approach to what you were going to do originally.
That could definitely happen. I mean, sometimes the studies actually show that people who get second opinions, often the diagnoses and the plan of action often changes after they get a second opinion. So it's really not a bad thing. And again, probably for something like a sinus infection or earwax, I don't know that you really need a second opinion. But when you're talking about cancer diagnoses, surgery, any of those kind of medical diagnoses, I definitely think if it's something you're not comfortable with, then it may be time to get a second opinion.
I'm certainly not qualified in human psychology, but it would seem to me that when you go and get a second opinion, it would sort of relax you, deal with some of the anxiety, even if you go back to the original physician to have whatever procedure done, right? Because you feel like, well, I've delved into this deeper. I've taken charge of my own health, and now we're moving forward in this way.
I think that completely makes sense. I've had people come to me for a second opinion from elsewhere, and they say they just didn't want aggressive surgery. So is there any other option? So sometimes it's just that. They're not comfortable with the procedure, the downtime, something about it just scares them. Hearing it again in a different way may just alleviate that anxiety for them.
There you go. Well, Dr. Kalpana DePasquale is with us. She's the founder of St. Augustine Ear, Nose, and Throat. We're talking about second opinions and doctors' opinions and the like, and regardless of what issue you or a friend of yours or a family member may be dealing with. If you have any questions or you'd like to reach out to Dr. DePasquale, we encourage you to do that by going to the website saent.net. That's saent.net. And, of course, Dr. DePasquale has offices both on 312 over on the island, just off of 312 on Plantation Island Drive, as well as in the northeastern part of the county off of US 1 in the Ponte Vedra and Nice High School area. So keep that in mind as well. It is 23 minutes after 8 o'clock. We're going to get up to 81 degrees today. No chance of rain today. High of 79 degrees tomorrow, Saturday. No chance of rain actually all the way through Monday night of next week. Very young Michael Jackson, the Jackson 5, Never Can Say Goodbye from the early 1970s. It's exactly 8:30 here in St. Augustine. Beautiful blue sky. It is nice outside. Currently 68 degrees on our way up to a high today of 81. Dr. Kalpana DePasquale is with me here live in the studio, and she, of course, is the founder of St. Augustine Ear, Nose, and Throat with offices over on the island just off of 312 and also in Ponte Vedra in the Nice High School area, and we appreciate her taking time out of her day. She joins us on Friday mornings. If you have any questions for her at any point in time, you can always check with us on Facebook. Send us a message on Facebook at WSOS Radio, or go to staugustineradio.com and click on the Contact Us button and send us a message that way, and we'd love to hear from you. This morning we're talking about second opinions and the like, and asking your doctor, and saying, hey, I would like to get a second opinion, and how you actually go about doing that, the importance of making sure that you have your records and trying to deal, I guess, with misdiagnosis. Let's talk about that just briefly, too, Dr. DePasquale. I mean, how often, I know that may be a little difficult because you're a doctor, you're a professional, but how often do doctors get it wrong?
I would say that most of the time when a second opinion is sought out, the original doctor seeing the patient isn't flat out wrong. It's more that the second doctor may have a different idea or a different angle about how things should be approached and maybe some additional ideas. But most of the time, even I could say in my own experience when I've seen doctors, patients who have seen other doctors and come to me for a second opinion, it's not really that they're wrong. They're usually right, in fact, but just may have a different idea about how to manage things. It's more there that I feel the differences in our opinions differ.
Right. I guess, too, we have to look at it. It's not often a situation where there's a plumbing problem. There is a leak in that pipe, and that is exactly what it is, right? You're dealing with a whole different, kettle of fish, if you will, the human body, right?
Right. And there's just so many different ways to address the same issues. Obviously not 100 different ways, but just each doctor has their own sort of way that they address things.
Right. Dr. DePasquale is with us live. So I'm going to give you another sort of consumer perspective. Just try to throw this stuff at Dr. DePasquale, that what we say, but we often don't want to actually say to doctors, so we can get away with that here on the radio. So sometimes we have this perception as patients that you guys do tests and things like that just as a way to CYA, if you will, to make sure that you don't get sued by some lawyer on a malpractice issue, or, how often does that happen?
Again, I think that varies from doctor to doctor. I mean, for me, I really want to have a reason when I'm doing a test. And
Right.
just because a patient comes in and let's say one of the more common things we get is maybe a headache or something like that. And then the next step is I've got a brain tumor. We really have to have some rationale for ordering an MRI. So again, I don't feel it's my place if I don't think that the patient really has a brain tumor. So I may even refer them to a neurologist for further evaluation. And if they really need an MRI, then that doctor can do it. So I always feel that there should be some rationale. I try some minimally invasive things first. But if they really need to study, that's not a problem. It's just that we don't want to do it as a knee-jerk reaction.
Right. Interesting. How often do you think that doctors think about malpractices? I mean, is that something that's always sort of over your head? And I do think as consumers, we are sort of mindful and even concerned for our doctors. We feel like, that you guys always have to function in a world where you feel like, gosh, one tiny little, not even mistake, but just something done a certain way could result in your being sued.
I mean, I guess it's always there, for all of us. But, again, if you're doing the right things, you're following the proper protocols, I don't know. I mean, I don't have experience in that area really to speak of, but I just say that, you do the right thing. You try to do the right thing by people, and I just manage my life that way.
Yeah, there you go. Dr. DePasquale is with us here live in the studio, and she, of course, was St. Augustine Ear, Nose, and Throat. St. Augustine Ear, Nose, and Throat. Hey, one thing we want to point out, we've been talking about how you should feel comfortable in going out and getting a second opinion, but let's talk a little bit about cost issues. A lot of our listeners may be Medicare beneficiaries, for example. Does Medicare typically cover a second opinion or not?
Actually, Medicare does, but it usually it's 80% of what the second opinion is. And some of the other insurance companies may cover something, but it may not be 100%. So the important take-home message for patients who wish to seek a second opinion is really call your insurance carrier and explain to them that you want to seek a second opinion and find out what's covered. The other thing people don't realize is that some tests that may have been done, maybe another doctor wants a different test, sometimes that's difficult to get covered as well. So it's really a good idea to have a conversation with your insurance company, find out what's covered, what's not covered, so you're not surprised.
And two, I guess some people that have, HMOs or they're part of these provider networks, that may make it easier to get a second opinion too in terms of on the cost side, right?
I don't really know about that because HMOs usually require authorization, so the process may be a little bit more convoluted is my guess. But again, my staff handles that, so I'm not really sure. But, as far as I know, you always need an authorization. So you may have to get the new doctor that you're seeing may have to have an authorization for that visit. So I don't know if it gets more convoluted there. But HMOs always require an authorization for every doctor you see, every procedure you get done, every test you get done. So typically it's a lot harder.
Okay. Well, I guess the lesson from that would be get in touch with your insurance company, right? When you're contemplating getting a second opinion and have them explain to you the cost ramifications.
Exactly. No need to be surprised on the back end.
Right. There you go. Well, once again, Dr. Kalpana DePasquale is with us here live in the studio as she is every Friday morning, and we're talking about getting a second opinion on any healthcare procedure. If you have any questions at all, you can always get in touch with us through our website at staugustineradio.com. You can always reach Dr. DePasquale as well. You can call this telephone number to schedule a consultation. That number, 904-461-6060. That number again, 904-461-6060. And try to remember this website address. There's a lot of good information there, saent.net. That's saent.net. The Rascals, I've been lonely too long here on 99.5 WSOS. It is about 16 minutes before 9 o'clock, 69 degrees here in downtown St. Augustine on our way up to a high today of 81. If you liked yesterday's weather, you're going to love today's weather. It's going to be basically the exact same thing. Blue sky, no chance of rain, a little bit lower humidity than we should have at this time of year. More of the same tomorrow. Lots of sunshine, no chance of rain. No chance of rain all the way through really Tuesday of next week. The only thing that changes from Saturday to Sunday is the introduction of wind into our forecast. We're expecting gusty winds Saturday night and Sunday, and that'll make the temperatures a little bit cooler. It'll feel cooler, certainly, with the wind chill, but our high on Sunday, only 74 degrees. How does that sound, Dr. DePasquale?
I'm loving it.
That's like the perfect weather. You close your eyes and you think, okay, It's going to be 74, windy. You have got to go buy a pumpkin. You know?
Exactly. It's time to buy that pumpkin and carve it and put it out there.
I mean, if you're like the folks over at First United Methodist Church over here downtown, where they have probably one of the most amazing pumpkin patches. They've been doing that for years. I mean, Sunday when it's windy and it's 74 degrees and you really have to put on a jacket, you know in your heart you've got to go buy a pumpkin.
I know. It must be great for their sales.
You think? I bet you pumpkin sales all around St. Johns County will be through the roof on Sunday if this weather forecast holds. So, do you like carving pumpkins?
I don't actually like the carving, but my boys usually carve.
Oh, they
now,
like that?
in the last couple of years, I haven't really been as excited about that. It was much more fun when they were 5.
I love pumpkin. You know, anything pumpkin. You know, so I sort of understand. Starbucks and everybody having this pumpkin that and pumpkin Oreos and all that. Although I think they've gotten a little carried away with that.
I think pumpkin Oreos doesn't sound very good.
You don't
to
think
me.
that sounds very
No.
good? How about at Dunkin' Donuts? They have like everything. Pumpkin. I haven't been to a Dunkin' Donuts in years, but when you see all the ads, it's like, pumpkin stuffed jelly donuts. And I mean, it's all pumpkin all the time. All their, coffee drinks and pumpkin.
I like pumpkin coffee.
Do you like
that's
that?
delicious, yes. But, the donut, jelly-filled pumpkin, I'm not so sure about. So I think you can take it a little too far.
I think Dr. DePasquale is a purist when it comes to donuts.
Yeah, I probably would rather have a Krispy Kreme.
Yeah, I'm a Krispy Kreme fan as well. Dr. DePasquale is with us, and we're talking about second opinions and, basically how you interact with doctors and about how to deal with those issues. I know some of us have. If you're just joining us, I was mentioning to Dr. DePasquale how we feel like if we ask for, if we tell our doctor we want a second opinion, we almost feel like we're hurting their feelings. And she, as a medical doctor and a specialist to boot, is telling me that what?
It shouldn't really be hurting your feelings. I mean, it's out there these days. People get second opinions. And, if you're confident enough in what your diagnosis was, I mean, again, people have differing opinions, but it's not something we should be ashamed about. I think we should definitely have respect for our physicians and say things in a very nice and professional manner. But other than that, it's everybody's right to get a second opinion.
Sure. And talk to us a little bit about, when a second opinion makes sense. Like in your world, we were talking about how if somebody has a earwax issue, obviously they don't need a second opinion. If you go and see your primary care physician and they say, hey, you've got bronchitis, you probably don't need a second opinion. But talk to us about when, you would think as a human, not just as a doctor, when you would recommend to a friend or one of our listeners when they probably should consider getting a second opinion.
When it's a diagnosis of cancer, that might be a good time to get a second opinion. And again, not always. Some cancers are very straightforward. Again, I think we had talked a couple of weeks ago about doing some research on the internet. So I think that's a great place to start about your diagnosis. Do some research, see what other methodologies there are to treat that condition. And if you feel that there's something that wasn't discussed with you or an option, probably the best thing to do would be to go back to your doctor and discuss those other alternatives with your doctor. And then maybe they could just be managed that way. And then if not, then at that point, maybe a second opinion would be in order.
One thing, too, we learned from Dr. DePasquale is the importance of, your medical records when getting that second opinion. If you just go and consult with a doctor and you don't have any data with you about your health condition, that can be a pretty frustrating meeting, I would imagine, right?
It really can be, I think, for the doctor and patient both, because we have nothing really to go on. You're there for a second opinion. It's nice to know what the first opinion was, what studies have been performed, what the opinion of that doctor was from the studies, et cetera, et cetera. So it really makes a big difference to be prepared and have all that information with you at the time of the visit.
So with your original physician, if you've decided that, hey, I need a second opinion, you should ask your original physician for what? I mean, help us with the language. What should we be asking for?
I think you can just say, I'm really considering a second opinion. Are there any other ways to manage my condition? I'd like to know. Sometimes at that point, it may just open up a good discussion between you and your current doctor, and maybe at that point you don't feel it's necessary. But if you do, again, I don't think that the physician should be too offended, again, if it's done in a nice way.
Right. All right. Very good stuff. Lots of great information, of course. And if you have any questions about ear, nose, and throat issues, right, do you know anybody they should call?
I do. I think they should call me.
Whether it's for a second opinion or a first opinion,
absolutely,
right?
Absolutely.
And you can reach Dr. DePasquale, of course, here in St. Augustine, and they can schedule a time for you to meet with her either at their offices. Of course, they've been over on the island off of the 312 bridge for a long time. And also, they have a relatively new office that's been open about 5 or 6 months now, right?
Yes, I think it's about 6 months now.
Yeah, 6 months over on US 1 North in the Ponte Vedra and East High School area. So they'll schedule you with, at the location that's most convenient for you, depending on where you live here in St. Johns County. The telephone number is 461-6060, for St. Augustine ear, nose, and throat. That's 461-6060. And I know it's hard to remember phone numbers when you're driving around, so try to remember this website, saent.net. That's saent.net. It's 11 minutes before 9 o'clock.
As I write this letter, send my love to you.
Gary Puckett and the Union Gap here on 99.5 WSOS from the 1960s. It's just a few minutes now before 9 o'clock on this beautiful morning, and we're wrapping up our time this morning with Dr. Kalpana DePasquale, and she, of course, is the founder of St. Augustine Ear, Nose, and Throat. Their office is located over on the island just off of the 312 bridge and also on US 1 North in the Ponte Vedra Nice High School area. This morning we've been talking about, second opinions and the like, and how it's okay for you to get a second opinion. And sometimes I think we think here in St. Augustine, Dr. DePasquale, I'm just speaking as a consumer potentially of medical services, that, well, I guess if I want to get an expert opinion, I better go to Atlanta, or I better go to Miami or Jacksonville even. The notion that, why would you have any really qualified experts in a small city like St. Augustine? That's dead wrong, though, isn't it?
Definitely. I think that there are definitely some instances where that is true. You want to go to a bigger city. If you have something unusual, if you have a cancer that's large, has spread, something unusual that people are not familiar with treating in this area, I think that can certainly be true. But I also find that people think that about very general basic diagnoses, hearing loss, sinus infections. Those things are not necessarily things that you need to seek advice from big city doctors to diagnose.
Right. And I think, too, just something I've observed, just not only by getting to know you, but other doctors around St. Augustine, you all, to be honest, based on your credentials and your educational training and your experience, you could practice medicine in Cleveland, Chicago, anywhere you want. You choose to live here in St. Johns County for the reasons that a lot of us choose to live here, because it's one of the most wonderful places on the planet.
That is right. And it's such a great place if you have a family, and it's a great place to raise children. The schools are just amazing. So there are just really a lot of reasons why we chose to live here. And we've been here now for almost 13 years. So. Yeah.
And you found that to be the case, too, even with physicians that, aren't in your specialty area, that there are other physicians, I would think, that you look around and you say, these are pretty talented men and women,
Absolutely.
that just ended up here in St. Johns County because they wanted to live, near the ocean with amazing schools, a climate where you have days like today. That's a reason for you to live somewhere, not just because you want to be part of the Johns Hopkins medical system in Baltimore, right?
Right. And there are some people who that's what they want. They
right.
want to be part of that academic kind of situation, which is great. But to each his own. For me, I knew I wanted to be in private practice. So that it was a different scenario for me. If I wanted to be in academics, I think that definitely I would have wanted to be in a big city, because that's where those academic institutions are located.
Right. And as Dr. DePasquale has told me, one of the main reasons she ended up here was because we have the nicest patients on the planet.
That is right.
You go to other cities and the patients are just downright mean, but not here. We're all so nice, right?
Everybody's nice. Absolutely. Never come across a mean patient ever.
People here are very, very good. This is a very special place, as you know. Well, Dr. Kalpana DePasquale, we appreciate you taking time out of your busy schedule each and every Friday morning. She joins us. Thank you.
Thank you for having me.
And if you have any questions for Dr. DePasquale, we encourage you to reach out to her. She'd love to hear from you. You can call and schedule a consultation if you have any issues at all dealing with ear, nose, and throat health. You can call 461-6060, and you can schedule a time to meet with her either over on the island at her offices there or in the Ponte Vedra area. You can call, once again, 904-461-6060. You can learn more about her, too, including a detailed bio and all that kind of good stuff, and more about the practice and the different services that they provide by going to saent.net. That's saent.net. And we'll see Dr. DePasquale again next Friday. Thank you very much.